September is Prostate Cancer Awareness Month, and joining me today is Dr. B of the Prostate Cancer Institute of Arizona and Dr. StClair, who knows firsthand how important the Prostate Cancer Institute of Arizona is fighting prostate cancer. I'm saying prostate a lot right now, Dr. B, because it's a month we got to get aware, we need to start talking about it, and it's so important. And I love that you brought in Dr. Patel last week. You're bringing Dr. StClair in here too to talk about this, and I think that's the important thing, Dr. B, is that we got to talk about it. Am I right?
Completely.
Yeah, and that's what helps us. So I'm going to talk to Dr. StClair here because we talked about firsthand. Let's talk about you in the prostate fight right now that you went through.
Okay, well, my father had prostate cancer at a relatively young age, so I was expecting to get prostate cancer. Actually, we think every man would get prostate cancer if we live long enough. So I've always been attuned to knowing that I probably would need prostate cancer treatment at some point. So when I did get diagnosed with prostate cancer just a few months ago, it wasn't a surprise. I did the updated research that I'd already done to find out what treatments I thought would be best, and it was clear to me that low-dose brachytherapy, which is what Dr. B offers, it is the best treatment. Certainly in terms of scientific literature and everything else. Best treatment in terms of best outcomes, best treatment in terms of lowest adverse side effects.
Yeah, and I think it's neat that you, being a doctor, actually went and did research. You kind of like didn't go, oh, you know, I know Dr. Wilson down the street, or I know this person. You actually went and looked yourself a little bit.
Well, I sort of started the process of letting the other doctors help me direct my care, and I could not find a provider who provided low-dose brachytherapy without going through the extra effort that I had to just actually ultimately find Dr. B.
Yeah, and again, this process is something that's been around for a while, but we don't hear so much about it, and that's where, again, Dr. B, you're kind of like letting, again, the word out that this is a way to fight a certain type of prostate cancer. And what type of cancer is that, prostate cancer?
Well, this is the prostate for early stage prostate cancer, when the cancer is confined to the prostate. Low-dose rate brachytherapy or prostate seed implant is an excellent modality for these type of patients, such as Dr. StClair.
Yeah, and I think one thing that men get scared about is what's going to happen afterwards. Am I going to be able to walk straight? Am I going to be able to still be intimate? Am I going to still be doing things? Especially as we're starting to find younger men getting prostate cancer, and we're knowing that with this type of procedure, you are still able to get back out there and function and be much better.
Well, it's the simplest and most direct treatment, and it has the best profile in terms of not only outcomes, which is you don't want to have your cancer recur, but also in terms of side effects, which are basically urinary, sexual, and bowel function. In the long term, low-dose brachytherapy has as good or better a profile for all of those than does any other treatment available.
Yeah, and again, doctors, you recommend, let's start talking about this. Let's actually not try to hide away from it. I actually saw Dr. Patel yesterday. I have no problem seeing it. We went through an exam and checked everything, and that's what's so important here too, is to get checked. Am I right?
Completely. I mean, early detection allows for cancer being found in the earlier stages, which have excellent cure rates. Not just with LDR brachytherapy, but any treatment. The cure rates are above 95% when we're found early, and that's really the key for awareness, to make it have patients to be able to found in these early stages.
Yeah, and I love doctors who bringing other people in, doctors to talk about this, but a doctor who knows firsthand about, of course, getting the procedure done, which is so important. So I thank you both for coming in.
Thanks.
Doctor, it's always nice seeing you, Dr. B, and thank you, Dr. StClair.
Thank you.
And again, you want more information, head over to aztv.com. Dr. B is part of our Live Well program. You'll see it on there, and it's so important to start getting checked in. This is the perfect month, men. So it's not over. We still got another week of this, so go talk to your doctor. So thank you.